Welcome back. The news that there is an Adderall shortage may have struck you as not particularly riveting, but there is a massive story beneath that shortage that tells us quite a bit about American mental health and its remedies. Very happy to have with me Dr. Asha Flashpoint, who is the medical director for community health for Beaumont Health System. Doctor, really good to have you here.
Thanks for having me, Devin.
I was telling you before we started that when you first read that headline, Adderall shortage, it is so laden with what it really means and what it's telling us about where America is right now, or am I overselling that?
No, I think, ADHD, attention deficit disorder, is a serious illness, and a lot of people have it. And if you don't have the right medications to treat it, it can cause a lot of problems for individuals.
We also, though, know that it is a terribly abused drug. There's an awful lot of people who are, in fact, famously the former Speaker of the House, Lee Chatfield, among the litany of accusations against him was that there was some trade going on of Adderall. There's a lot of people for whom it has not been prescribed, but who still really want it. What is that about?
So it is a controlled substance, so it's considered a scheduled drug, and so therefore it's regulated because it can have addicting properties to it. So it depends. Like, for example, if you really need the medication, think about Adderall or any type of stimulant medication for ADHD being like glasses for the mind. And so if you put glasses on your mind, you can see clearer, you can focus better, that type of thing. If you don't need glasses and you're wearing glasses, it's not very helpful to you and can be harmful even. But if you need them, it really helps you focus and see clearly.
It's a really good way of putting it. I think, too, though, that some people, it's a little confusing because when you think of somebody who's ADHD, the H in there is hyperactivity. A stimulant wouldn't seem to be what somebody needs.
Yes.
But it stimulates the brain to work in a different way.
Absolutely. So it actually works on your neurotransmitters of the brain that increases the dopamine and the norepinephrine. And so you need that to be able to focus better. It works on the prefrontal cortex of the brain.
The people who are abusing it, though, and I assume that that's part of what's helping lead to the shortage, is people who haven't been prescribed it but still want it. What do they want from it? What are they getting from it?
So again, it's a medication that you can get a high from. You can abuse it. It's just because it's basically an amphetamine, and so people do use it to get high. But most of the people that are getting it from their physicians, hence the shortage, they're getting it prescribed. And so, but still, there is an actual shortage going on for especially the people that need it.
I've also heard that there are some people that seem to believe that it helps them lose weight. There's something to that?
It can, because it is a stimulant medication. So any stimulant can possibly help you do that.
So what is going on that we have now a shortage of it? Is it there's so many people need it and want it, or is it like everything else and we've got supply chain issues?
So I think it's a combination. So I think right now there is a supply chain issue in terms of the major corporation that creates this medication, that they did not have enough workers to actually make the packaging for the medication. And then the second thing is that there has been a lot more prescribing going on, and I think the reason why is from the pandemic we've seen an increase in the number of ADHD diagnoses as well. So there is more prescribing happening, so there's more demand, but then there's also a supply chain issue.
What do you think is going on there that we've seen a jump in these diagnoses? Does it tell us something about COVID and about the pandemic and the way that we've all had to respond to it, or is something else going on?
Yeah, so I think the thing is that the pandemic has been so stressful for everybody. And so in stressful moments, and you're multitasking, you're trying to do more things, you're having a harder time focusing. I think there's been a lot of education on ADHD. And so many adults who maybe were not diagnosed as a child have learned about ADHD and are thinking, maybe I do have ADHD and I might need help, see their doctor, and then decide if that's appropriate.
And this is where that Adderall story, I said it kind of hid a much larger story, and this is part of it. The mental health of America, I guess I would say the whole world right now, but we'll focus on America coming out of the pandemic, is still very, very fraught, especially with young people.
Yeah, absolutely. The amount of anxiety and depression that I'm seeing in the office is incremental. Like it's very difficult actually to go to work sometimes because you see so much anxiety, you see so much depression going from all the way from being young all the way to being older, to being a geriatric person who's lonely, to a young kid that's getting bullied in school. I mean, the stress and the amount of anxiety and depression in our society is, I think, in an unprecedented amount.
I know a number of counselors, people who specialize in young people, who cannot take new patients anymore. That's another part of this crisis right now, so much need and not a whole lot of slots left.
Yeah, I think this is where, like, me as a primary care provider it's very helpful, because we're able to bridge people in between the opportunity of being able to see a psychiatrist or a therapist. There is a huge wait right now because there is a big demand, but you can still see your primary care physician to be able to see if you might qualify for medication or for counseling or therapy.
It's interesting because we talk a lot about law enforcement people not really being equipped to be the first line of mental health defense. I would say a lot of parents aren't sure that they're always equipped with the best answers. They don't always know exactly what they're seeing. They know their kids better than anybody else, but they don't always know the best way to help, maybe.
Yeah, so I think that's the thing when you can, if you are starting to notice behaviors that are difficult, your child's withdrawn, having difficulty concentrating, maybe not doing as well in school.
So changes.
Yeah, changes in their normal behavior, their routine. That's when you might want to have a conversation with their doctor and also your doctor about what can I do to help support my child better.
It's a lot to think about, and I fear it's only going to continue to worsen here as we keep finding the fallout of the pandemic. Doctor, thank you so much for coming in. I really appreciate your time.
Thank you.
Yep, you bet. Quick reminder, of course, it is a big day coming up on Thursday. The parade coming up live from Woodward Avenue. We certainly hope you will, as so many do, join us for Thanksgiving morning in Detroit. We will see you then. That's it for Flashpoint. Meet the Press coming up next. Have a great week.